The information discussed by the host and guests on this talk show is meant to be informational only. Listening or calling in to ask questions for our guests does not create a patient-doctor relationship. Rely on your own doctor or healthcare provider's medical advice to treat or diagnose any conditions you may have. Nothing discussed on this talk show is meant to replace your doctor's medical advice. You should never stop your current medical treatments or delay getting medical treatment because of anything presented in this program. If you want more information about a medical condition or treatment discussed on this program, talk to your doctor.
It's time for Health Check with Heidi Godman, a daily dose of health and wellness information. Call or text Heidi your questions at 373-1220. That's 373-1220. And now here's Heidi Godman.
Hi, everybody. Welcome to Health Check. I'm Heidi Godman. Hope you are doing very well today. We have a great program lined up for you. We are going to be doing a Lightning tickets giveaway. So I want you to be standing by to dial your phone, a Lightning ticket giveaway. We'll do that in just a little bit. The number will be 373-1220. Don't call yet because we're not doing it yet. But in a little bit, we're going to give away a pair of Lightning tickets. Also today, it'll be time for our weekly Brain Boost, and we'll be speaking with Dr. Dean Sutherland about some new images that scientists have detected in the brain and how it may help us understand more about the brain working. So we're going to be talking about that. But we are going to start out today by talking about brown spots that you might have on your face. Are these okay? Are they dangerous? Do you need to have them removed? Should they be checked out? What are they? Is it only older women who get them and men? Could it be younger people ever? We are going to find out. My first guest is a Harvard and Yale trained aesthetic dermatologist. Her name is Manjula Jegasothy, and she is the founder of the Miami Skin Institute. Hi, Manjula.
Hi, Heidi. Thanks for having me back on your show.
So this is really something where people, I think, are concerned that, it's only with aging that you get a brown spot, especially on your face. But it can happen at all ages, right?
Absolutely. And so that's why it's very important if you have brown spots anywhere on your body, before you seek any kind of aesthetic treatment to get rid of them, please see a board-certified dermatologist to get a diagnosis on them. Frequently, you may have brown spots of 2 or 3 even different etiologies, different reasons you have them, existing at the same time on your face or arms or hands, and so they need to be treated differently. I frequently at least once a day, see patients who've gone to a med spa first and had their brown spots lasered and either got burned or had no results at all, and that's because they weren't diagnosed properly. They weren't diagnosed to be the kind of brown spots that can't be treated with laser, which there are many.
But there are some brown spots that are purely sort of cosmetic annoyances and others that could be a serious condition or an indication of something else. Tell us first about just the benign sorts of brown spots.
Sure. The benign sorts of brown spots fall into 3 basic categories. The first is, or 4 we could say. The first is benign moles. These are things that you've had your whole life, birthmarks we call them, or sometimes they even can start to appear in puberty or a little bit later, but they're very kind of bland, and they're brown, they're solid brown, they're not kind of patchy. And those are ones that are benign, but they're not able to be removed with current technology either. The second kind of brown spots are very related to the sun. We call them sunspots or freckles, or the medical term for them is lentigines. And essentially, those are the only ones that can actually be lasered off because they're an excess pigmentation that's caused by sun damage in the skin. And once that's taken away, if you protect yourself in the future, they won't come back.
Mm-hmm. But there are other categories you mentioned.
Sure. So the other 2 categories are seborrheic keratoses, which are what the old ladies used to commonly call liver spots, simply because they were the color of liver, for no other reason. They have nothing to do with your liver. And they basically are growths that sit on the surface of the skin. And they are not necessarily related to sun damage. They're mostly genetic. And those cannot be lasered because they don't have any real melanin or pigment to them. So the best treatment for them is a very light spray with the liquid nitrogen. The cryotherapy is the name of the procedure, and it's the cryotherapy machine we use that sprays the liquid. It basically causes the growth to die, and so it just kind of flakes up and falls off. And that's the treatment for that. And that's what I commonly see misdiagnosed. People think that those are sun-related, and so they get treated with the laser, and it simply just doesn't do anything.
Mm-hmm. All right. And tell us about some of the other categories.
And so the major one I wanted to talk about today is called melasma. And it's basically a hormonal condition which happens in women of all ages. And it is mostly women. There are very few case reports of men getting melasma, and that's because their hormones are sort of out of balance. And so for men who get this condition, see an endocrinologist, get your hormones balanced, and you'll be fine. With women, it's a little more complicated, and that's why, there tend to be more women, vastly more women that have it than men. It's basically your body's skin cells that make melanin, the melanocytes, which become hypersensitized to your body's estrogen. And we think that the birth control pill may play a part in that. Hormone therapy, replacement hormone therapy in older women may play a role. And then often it's genetic and based on ethnicity. It's seen in a much higher degree in people of Latin descent and people of Asian ancestry.
Mm-hmm. All right. So when it comes to treating melasma, what are the basic approaches?
And so it's complicated because we cannot ever treat the underlying issue, which is the body's estrogen. Women need estrogen not only just to be women, but to regulate their cycles and for fertility. And then even after menopause, you still need your estrogen because it's protective of the heart. It protects against heart attacks, and it also protects against certain kinds of cancers. So to block a person's estrogen because of them having melasma is not really medically feasible. So what we have to do is treat it from the outside. The common treatments are using a topical bleaching cream, the most common of which is Triluma cream, which is a prescription. It's been available for about 10 to 15 years. But there's a new product that I think presents a significant breakthrough in the treatment of this kind of brown spot deposition or melanin deposition related to hormones. And it's made by the same company that makes Botox, Allergan, and it's called Lytera 2.0. There was a Lytera in the past. It's been around for about 10 years or so, which was not as effective. It basically only blocked melanin production on one of the enzyme pathways that produce melanin. This new Lytera 2.0 blocks melanin on 4 of the pathways that produce melanin, and it does not have any retinol or retinoid or any kind of hydroquinone. So it's even safe to use during pregnancy, which is the time period when most women begin having problems with this condition.
All right. So how can you expect how do we look at treatment? I mean, what's going to be happening when you apply these different things? What kind of results can you have?
So I tell my patients, you're going to apply one of these creams every night, only on the brown spots. And you can see, generally about a 50 to 70% resolution within 6 weeks or so. However, if you get sun, then you set yourself back a couple of weeks in treatment. Or if you stop using the treatment, it all comes back. So again, as I said, I cannot get to the base of the problem. I cannot reduce your estrogen levels or your skin sensitivity to the estrogen. We haven't figured that out yet. But we can control it from external means, but you have to do these external means possibly through menopause and possibly throughout life.
Okay.
A typical regimen is I have these patients use this cream every night. It's their night cream on the brown areas, and then they do a light pyruvic acid or salicylic acid peel every 3 months, and we can keep them clear.
Whoops!
Hello?
Yeah, I think we lost you for a second. Well, that's very encouraging that you can manage the condition.
Yes, it's highly manageable. It is not curable.
All right. Well, so that's it about brown spots. And then, of course, the most serious brown spot, could be a sign of melanoma. And tell us again when we need to go to the doctor for that.
Yes, so any mole that you have or any brown spot you have that is rapidly changing in any way, changing color, growing very rapidly, faster than you are growing if you're a child or teenager. If it's changing its border shape, so it's going from round to oval or even, a different kind of shape than that. And if it bleeds, or if it develops some sort of ulceration. Those are all things that need to be seen by a board-certified dermatologist for a biopsy immediately.
All right. Well, very interesting to know that there are things we can do about most typical brown spots. But the most important thing is to go to your board-certified dermatologist because it may not just be skin deep. I mean, it may be something that is really an underlying condition. So thank you so much, Dr. Manjula Jegasothy, for keeping us up to date on that. And we want to keep on talking to you. We have lots more to talk about. We're going to take a quick break, though. So everybody, please stick around. More with Dr. Manjula Jegasothy, who's an aesthetic dermatologist. Also, in a little bit, we're going to be giving away a pair of tickets to go see the Tampa Bay Lightning play. If you want to call in and get those, we have them right here. We'll probably do it in about 15 minutes. This is Health Check with Heidi Godman on WSRQ. I'll be right back.
Keep falling on my head, and just like the guy whose feet are too big for his bed, nothing seems to fit.
Welcome back to Health Check. I'm Heidi Godman. Hope you're doing well on this kind of gray day out there. It's nice and sunshiny and happy here inside the studio because we're getting answers to medical questions that so many people have. Today we are talking about a particular condition called melasma, and that's when brown patches might appear on your face. Could be due to hormonal changes from pregnancy or from menopause, or could even be from sun exposure. A lot of people want to know, can you just have them lasered off your face? My guest is Dr. Manjula Jegasothy, who's a board-certified aesthetic dermatologist. Manjula, what's the answer?
So the easy answer is sometimes. Basically, we talked about the external ways to take care of it, like with bleaching creams and with peels. Until last year, we probably had no way to laser them because, in fact, the brown spot laser, which is commonly called the ND-YAG, which is what people use for sun freckles, does not work in melasma. And in fact, certainly in olive skin types, can make the condition worse. So that's why I strongly recommend before you get a laser with somebody who is not a board-certified dermatologist, you get a diagnosis on your brown spots first, so that you don't get the ND-YAG laser for sunspots when in fact you have melasma, and so then it becomes much, much worse. The treatment we use for melasma that can sometimes work, that is also harmless if it's used in the proper way, is the Fraxel laser. The Fraxel laser works by drilling thousands of microscopic little holes into the superficial portion of the skin, and if it's done by somebody who knows exactly what they're doing and the way the skin looks under the microscope, they can dial the laser to a very superficial depth, so that even if it does not take away all the pigmentation, it definitely won't make the patient worse. It won't make them hyperpigment.
Mm-hmm. And are there any scars with that?
No, there's no scarring with the Fraxel. Again, if it's done properly by the right person with the right settings. And it can be quite effective in treating superficial melasma and melasma in very early stages. The only issue is that no laser can be done while the patient is breastfeeding or pregnant.
All right. So that is one of the treatments that you can use. But now there's another, right?
So that's the majority. That's the one that I really people know. In the last few years, we've been testing protocols where we can use for melasma.
All right. So, I'm sorry you broke up just a little bit in that answer. Tell us about the treatments for melasma. There's the Fraxel laser.
There's bleaching creams, there's peels, and there's Fraxel. I wouldn't use any other laser on melasma.
Okay. All right. So you can, in some cases, use a laser is the answer, but not in every
Yes.
case. Now,
And only Fraxel and not in every case.
Now tell us about a new treatment called, what is it, Viora?
Yes, so Viora is a radio frequency treatment, and we've talked about it a couple of times before in our previous shows. It's essentially a skin tightening laser, and so we were going to talk after melasma. Another common thing that younger people get is acne scarring, those pitted acne scars that we previously didn't have very good treatment for. But now I'm finding that a combination of the Viora, which is a radio frequency device which tightens the skin, along with Fraxel, which is the one we just talked about, which basically drill any holes that causes you to build collagen, and it therefore smooths the skin. So I find for acne scars a combination of Viora and Fraxel alternating every 3 months or so for about a year will fix even the most severe acne scar cases. And then because scars are active, they're more active metabolically than normal skin. The lasers do have to be maintained, or the treatments have to be maintained about once a year.
All right. So once a year, maybe you would get this. What about price?
So pricing is $500 in Miami. It's $500 a session per laser, and it could be less expensive in some of the smaller cities.
Now, are there other types of companies putting out these types of lasers or radio frequency treatments?
Sure. The Fraxel is a brand name. The generic name for it is fractionated non-ablation laser. And there are a couple of different brands. Fraxel is considered the gold standard brand. There's another brand called Infini, INFININI. There's another one called Intensive. It's INTENSIF. You just need to ask if it's a fractionated laser, and then they'll tell you. And then there are some that there are some places where there is no physician, and right now this procedure can be done by estheticians or anyone with a license higher than an esthetician, as in a nurse practitioner or a physician assistant, and that's called microneedling. And microneedling is sort of a low-grade variant of Fraxel because it also creates thousands of little holes that then cause collagen production. So if it's used by the right person, it can indeed improve your melasma and your acne scars, although not to the degree that Fraxel can.
What about people who don't do anything about acne scars until they're much older? You know, if you're in your 40s or something and you've always had one little scar here that you wanted to get rid of, sometimes you see actors on television and you think, I wonder what that is from. And I wonder if they're thinking, I should get rid of this.
If you have less than 5, actually the best treatment probably is to get, and this has to be done by a board-certified dermatologist, I would say, because we're the most versed in doing this. We actually cut the scar, not out. That's called scar revision, which plastic surgeons do. But we actually stick a needle underneath the scar and sort of free up that fibrous tissue that's pulling it downward. And then we put a little bit of filler into it. And that will smooth out a deep scar if it's solitary, if there's only, like I said, less than 5 on your face. But if you have more than 5, you need to do, especially as you get older, you need to do more skin tightening treatments because you'll find that those scars tend to sag worse than the skin around it. And so it becomes even more noticeable.
So how do you tighten it up then?
That's with the Viora radio frequency.
Okay.
So that's why I love the combination of the two treatments for acne scars. And so it depends on the person's age and how much sun damage they have and how aged their appearance is. But generally for people with acne scars, if they're on the younger spectrum, if they're under 35, they'll do more Fraxel treatments than radio frequency treatments. If they're over 35, between 35 and 50, they might do equal numbers of each. And then if they're over 50, they'll be doing more radio frequency treatments and fewer Fraxel treatments.
Mm-hmm. But then you were saying that you might want to do it once a year. I mean, is there just a way to get rid of a scar and then you're done with it?
With the filler, so if you have just one, like I said, like you asked me, or less than 5, generally when I do filler for those patients, They might need a touch-up every 5 years or so, but not very often.
What happens? Why would you need a touch-up? What is it doing, the skin?
Because, as I said, the scar itself, the cell in the skin that makes collagen is called a fibroblast. And those cells in scar tissue are much more active metabolically. They turn over much more rapidly. They overproduce collagen. That's why the scar looks the way it does. They overtake the hair follicles. That's why scars have no hairs. And so because they're so metabolically active, even late into life, they tend to reform. And that's the entire reason we have to keep treating them.
Okay. All right. Well, very interesting. Well, I want to thank you so much for giving us that information about not only getting rid of the brown spots on your face, but also if you have any acne scars. Very important, everybody listening, that you go and see a board-certified dermatologist. And Manjula, if someone wants to know more about you, how does he or she find out?
And please come visit our podcast on my iTunes channel, which has all my radio shows with Heidi and my videos on the news. It's at iTunes. You search Miami Skin Institute. All the information I present and is updated almost monthly is on my website at miamiskininstitute.com. And we also write a blog weekly on Google Plus and WordPress, which is also called Miami Skin Institute.
Fabulous. Okay. I want you to please stay with us, Manjula Jegasothy, because we want to keep talking to you. And everybody want to give away those Tampa Bay Lightning tickets that we promised you. If you would like to go see the Tampa Bay Lightning play, and I think they're playing the Arizona Coyotes, we have a pair of tickets right now to Amalie Arena in Tampa. If you want to give us a call, 373-1220. 373-1220 is the number to call for this pair of Lightning tickets. We are just going to give away. Whoever can call us first can have the tickets. I also want to let you know that starting Monday, March 20th, Health Check with Heidi Godman will be moving to 4 o'clock every day, Monday through Friday. We hope you'll come along for the ride. And again, if you're unable to make that, you could just search WSRQ in iTunes, or you can go to the WSRQ.com website and download the podcast and get lots of great information. Okay, again, 373-1220 is the number if you'd like a pair of free Tampa Bay Lightning tickets. First person who calls them can have them. We will be right back. This is Health Check with Heidi Godman on WSRQ. Welcome back to Health Check. I'm Heidi Godman. It's time now to find out how we can all get our bodies looking the way we want them to look before we get to that bikini season, which maybe you're getting into your bikini right now, except I think we're supposed to have some cooler temperatures this week, so you might want to hold off. But when you get into that bikini, are you uncomfortable with the appearance that you have? Also, if you are looking at your hands these days, are you thinking, gosh, I wish they looked a little bit younger too? We have some information if you are interested in doing something about it in a cosmetic way. My guest is Dr. Manjula Jegasothy. She's an aesthetic dermatologist and founder of Miami Skin Institute. So, I think that I know that you, Manjula, would advocate that everybody try to exercise and eat the proper diet first before seeking any kind of cosmetic procedure. But for some people, no matter what they do, they just can't seem to get that bikini area the way they want it looking.
Absolutely. I think it's all genetics. People respond extremely well and extremely quickly. Unfortunately, men more than women, to a good regimented clean eating and diet program, exercise program. But a lot of people I know are doing the best they can. They're eating normally and healthy. How little can you eat? You know what I mean? The standards have become so stringent now. Models are so thin. And, the fashion world, the dresses and bikinis and bathing suits are getting thinner and thinner. And so, it's hard to really live up to that standard a lot of times without a little bit of extra help.
Sure. So what can you do as a physician?
So I have a new sort of combination protocol I call the Vavoom Bikini Body, where it's two V's, which stands for Viora, which is radio frequency laser, which tightens the skin and smooths the cellulite in the bikini area. That means the posterior, the back of the upper thigh, the buttocks, the hips, and also tightens the skin around the belly button, especially if you've had children. The other portion of the procedure is the fat melting laser, which I have a brand new one called the Vanquish with a V, M-E, Vanquish Me, and it basically reduces fat about half an inch per treatment. So you can get yourself down about 2 clothing sizes with 3 to 4 treatments.
Now, some of these things sound like they're too good to be true, and you know what we always say about if it sounds too good to be true, it probably is. But there is some evidence backing these up, right?
Yes, the claims I make are all the claims that, not only am I seeing with my patients in my office, but those are the study results on the average patient that was taken care of with these procedures in order for them to gain FDA approval. So these are FDA study results.
And then how long do the results last?
If you do not gain significant weight, meaning more than 10 pounds, you should be able to perpetuate these results forever because we're killing the fat cell in this situation.
I'm sorry, say again how long it'll last?
Sorry, it should be permanent because we're killing the fat cell in this situation. If you gain more than 10 pounds, you're killing fat cells that we're killing at this one time period, okay, when we do the treatments. But then the other fat cells that are remaining, because we don't kill every single fat cell, if you gain more than 10 pounds, the other fat cells then get larger in size. So you've heard that whole adage, when you get liposuction, if you get fat, it'll come back somewhere else.
Mm-hmm.
That's because in liposuction, the surgeon is taking away, let's say, 80 to 90% of the fat cells in that area. So you'd have to gain significant weight for that remaining 10% of fat cells to grow bigger. However, if you gain a small amount of weight, the fat cells that were left behind in all the other areas that were not liposuctioned will get larger, and that's how we gain weight. Okay. I mean, that's how we look bigger and gain weight, actually. We have the same amount of fat cells as we had at age 6 months. You grow all your fat cells in the first 6 months of your life, and you never grow any more. So if you kill off some of them, you're going to be smaller in that area unless you gain so much weight that the other fat cells recompensate.
All right. Well, that's very important to know, especially if you're seeking treatments to melt those fat cells. Now,
that's why it's so important to actually to feed your infants properly according to pediatric guidelines, because there are studies that show that infants that are overfed or fed too much fat in their diet actually have more fat cells and have more trouble throughout life with obesity than children who are fed properly with the sort of RDA guidelines of percentage protein, fat, and carbohydrates.
Okay, so we have to be thinking about this right from birth. Tell us a little bit though about refreshing your hands. I know that this is a trend that a lot of older women, especially, are talking about.
Yes, and as people, social media certainly is something that's perpetuating this. I have a lot of friends on my social media who are older brides and second marriages and such, and they're posting their engagement ring photographs, and you know, you're like, oh my God, my face looks okay, but my hands look really old, and when I'm trying to show off this engagement ring, it may not be the best possible situation. But we have great new treatments for hands. Again, my sort of combination hand treatment, we call at the Miami Skin Institute, we call it the Very Refreshed Hand Protocol. And the Very stands for Viora, again, which is the radio frequency laser, which tightens the skin across the top of the hand, the top of the wrist where those wrinkles form, and especially on the knuckles, which can really be the portion of the skin where the hands look the oldest. So we tighten that skin, that's Viora, and then Refresh stands for Radius. Radius is a calcium-based filler which is the only one that has an FDA approval for filling the hands. And what that can do is sort of camouflage the ropey veins across the top of the hands. It can make the whole hand look plumper and fuller and not quite so bony and old.
Okay. All right. Does it hurt getting those injections in the hand?
Surprisingly not. There are not very many nerve endings there because we go fairly deep. So if you put a topical numbing cream on it, most of my patients say they don't feel anything at all.
All right. And then how long does it last?
The filler in the hands, the radius in the hands, lasts 2 to 4 years, lasts a long time. The skin tightening treatments on the hands last about 6 to 9 months.
Okay.
The Viora.
So there's going to be upkeep, and some people want to make that kind of investment in their appearance. And how much are we talking about wherever you might be in the country?
Sure. Generally, the filler is around $700 to treat the hands, and it might be more in New York, obviously. And then the laser is $500 around to treat the hands, and might be a little bit less in smaller cities.
All right. Well, so many different trends happening, and I want to thank you so much for keeping us up to date on all of these. Dr. Manjula Jegasothy, founder of the Miami Skin Institute. And if we want to get a hold of you, how do we do that?
You can always call for our office for information at 305-569-0067. You can look for information on our website at www.miamiskininstitute.com. Our blogs and our social media. We tweet every day, several times a day. It's at Miami Skin Ins. And then we have before and after, a big before and after patient gallery on Instagram, which is at Miami Skin Institute, and on Pinterest, which is Miami Skin Institute also.
Wonderful. All right. Always great to talk to you. Thank you so much, Dr. Manjula Jegasothy.
Thank you very much, Heidi. Have a great day.
You too. Talk to you soon.